Today, I'm going to introduce opioid use disorder. Opioid use disorder is a major concern impacting so many individuals, families, communities, states, and nations. In 2023, approximately 5.7 million people, or 2% of the US population, had an opioid use disorder. And opioids and opioid use disorder has had a significant impact on the city where I spent most of my adult life, in Baltimore, Maryland. In fact, I just came back from a run this morning where I saw someone off, which is essentially someone seeming like they're going to fall, but they're standing up and they seem to be falling asleep, but they don't. For the most part, they still remain standing, although it seems like they may fall over at some time. Within this drug class called opioids, there are natural and synthetic opioids. An example of a naturally occurring opioid is opium, and opium actually comes from the same exact plant that produces poppy seeds that people often eat on their bagels. An example of a synthetic opioid is fentanyl. Now back to the condition called opioid use disorder. And again, 5.7 million people in the US have this condition, which is about 2% of the population ages 12 and up. Check out my profile about 7 or 8 videos ago. I described the 11 symptoms that can cause someone to meet the criteria of a substance use disorder diagnosis. If someone meets at least 2 of 11 of those symptoms, they indeed have an opioid use disorder diagnosis. To provide a few examples, if someone meets the symptomology of an opioid use disorder, they may find that their tolerance is higher and that they need to consume a larger amount of that specific opioid to achieve the same effect that they're interested in. They may find that they're giving up important social, occupational, and recreational aspects of their lives so that they can consume the opioid or recover from its effects. And they may find that when they stop using the substance, they experience opioid withdrawal, in the sense that they're having all these symptoms related to stopping the use of an opioid. And there is a prominent risk when it comes to illicit opioid use because of the potential for a fatal or non-fatal overdose. This is especially true with illicit fentanyl and its analogs largely being present in the illicit drug market. And when I say fentanyl analogs, it's just a fancy way of saying fentanyl-related derivatives. Now that I've discussed opioid use disorder, in the next video, I'll discuss sedatives, hypnotics, and anxiolytics use disorder. Thank you.